It goes a long, long way. In the late 70s, I approached my friends at the Rotary and private donors, and with their help, we opened a small dispensary to cater for the needs of the poor and the underprivileged. You can imagine the plight of the poor when they had to take an accident case or they had to take a very sick patient for more than 5 kilometers from the mainland to the Coast General Hospital. BOMO today stands out as the largest NGO serving the community, especially in the field of HIV/AIDS.
The BOMO Medical Clinic is one of our most important partners, and they've really been an exemplary partner and a center of excellence, not only for the coast, but really as a bigger model for the country. What attracted us to BOMO is the fact that it's a private clinic, but its aim is to provide affordable treatment to the underprivileged and the needy. They also have a very impressive outreach effort to the community.
We have the clinical side. Now this is where patients come for outpatient services. The clinical services also includes departments like radiology, a 21-bed maternity unit. We have an operating theater for cesarean sections, for other minor surgeries. We have the pharmacy and the laboratory that run at a very, very subsidized rate.
We are actually complementing the services of the government at their rates, at the same time giving the quality that the private institutions are giving. If you want to give quality services, that means you have to charge accordingly. But here we are giving quality health care at the lowest cost possible. Balancing the two is almost impossible. We all know that quality comes with a price. So that is our greatest challenge.
At the present moment, we have about 18,000 registered clients. Half of them are on antiretroviral drugs.
The HIV program, it's dedicated to provide services to individuals and their families afflicted by HIV and its related issues. People who are helpless, who don't have their voices, without hope. We are dedicated to give them the hope.
Kusema kweli mimi hata kuelezea pia nashindwa. Juu na furaha moyoni na vile vile nikifikiria vile nilivyoingia hapa. Nilikuwa katika hali mahututi. Hasa ikizidi daktari ule niliompata anaitwa Abbas. Alinichukulia kama ndugu yake na amenitibu na amenisaidia.
There are quite a number of drugs that we want to use which we do not have, our patients cannot afford. An example is the chemotherapy for patients with HIV-related cancers, which we see quite frequently in our setup.
Yeah. Alafu zinatoka madawa napata bure. Hasa ikizidi pia chakula zingine pia anapewa bure. Ikizidi pia transport ya kurudi mpaka nyumbani pia anapewa.
We know that not everybody can access healthcare at such facilities because of transport, because of poverty, because of poor educational level. And so if these people cannot reach us, it's our duty to go into the community so that we can serve these people.
Jomvu is about 15 kilometers from BOMO Medical Center, and I'm here to visit my patient, Shaban Masha, who was a regular patient, but of late he's not been making it to hospital because he had a stroke and he could not come. Hodi jamani. Oditen. The family also was not able to raise the taxi fares to bring him to hospital. Zamda.
Safi tu.
Waendeleaje sijui?
Anashukuru si zako.
Kama unaisha hizo dawa zako. When BOMO enrolls community health workers, they normally require people who are HIV positive so that they can communicate well with the HIV positive patients because they undergo the same problems. Stigma, watu bado wakustigmatize hapo nje?
Tena sana.
Na wewe umechukua hatua gani?
Wao ndio wanawategemea kwingine kwenye chakula, wananinyima mpaka kula. Naambia yule mwacheni vile vile, ni hivi na hivi na hivi, tushamjua ni hivi na hivi. Sasa ingine ndio waga nashindwa yani mpaka vile nitajimudu.
Kwa hivyo ungependelea tuchukue hatua gani sisi kama watu wa BOMO?
Hapa ni kama wengi hawaelewi kitu gani kinachoendelea. Mkipata nafasi mje mweke VCT.
Tuweke VCT hapa.
We are going to Mabati Rolling Mills, which is in Mariakani. We had many patients who are coming from Mariakani all the way to BOMO, and the distance is about 30 kilometers. Within a month, we had registered 300 HIV positive patients from this region, and therefore we were forced to set up a satellite unit at Mariakani. We have a team of about 25 to 30 people in our outreach team that come to Mariakani 3 times a week to serve the patients who come from this region.
Wananisaidia sana na hata wengine walikija hapa walikuwa ni wadhaifu sana na saa hii kila mmonaye amenawiri.
Yombo is one of the most impoverished area of Coast Province. The center has about 250 children and most of these children are orphans. BOMO has started a feeding program for these orphans where we provide 1 meal in a day. Probably this is the only meal these children will have.
Mtambue kwamba janga la ukimwi liko hapa na sisi tumejitolea BOMO Medical Center kuleta huduma zetu hapa mtaani ili wewe uweze kunufaika kwako.
Sawa, bora sina mimba daktari. Amesema niko HIV positive lakini sina mimba.
Voluntary Counseling and Testing Center. Sasa uwezi jua tu hivi kwa vile tumelala na mtu ameathirika tuache na virusi, pia ukilala naye ni inamaanisha automatically umeathirika. La sivyo. Hiyo VCT hata BOMO Medical Clinic wao wanafanya hivyo. Na natumai leo Samburu wametembelea mtaani wa Samburu.
Our vision is to serve the people not only of the Mombasa district but beyond that. And keeping that in mind, we have opened a satellite clinic on the south coast, which is in Likoni, where we serve people coming as far as Diani, Ukunda, Kwale, Masimveni and other areas.
Initially, the patients used to come from just within this locality. That's the BOMO, Changamwe and Magongo area. That has a catchment population of about 100,000. But now, as BOMO grows, as our name grows, and as our outreach activities increase, we realize that our patients come not only from Mombasa district itself, not only from Ukunda and Diani, but also as far as from Voi. We have patients registered and enrolled in our HIV program who come from Zanzibar, Arusha, and Moshi.
My community come to BOMO with a lot of hope. They get quality health service, and at the end of their exercise, they feel at the bottom of their hearts that they were treated humanly. That is the basic human right of every individual, to be treated with dignity and respect.
We've had a long and fruitful partnership with the BOMO Clinic. We've helped it expand. It's having more of an impact than ever with the community. I felt really inspired by the work that they are doing.
We
we are trying to prevent transmission of the virus from the mother to the child. That can occur antenatally as the mother is pregnant, during delivery, or even postpartum. Majority of our pediatric patients become HIV positive because of that one thing. We try to reduce that by all the methods that are at our disposal. Our transmission rates are less than 2%.
Nimefurahi manake najua sasa siwezi ambukiza mtoto wangu, pia sasa inajilinda, so na pia kuuza nimeweza na CS kwa ajili sitaki ashikwe na maradhi, na pia kumnyonyesha asimnyonyeshe. Nashukuru sana kwa ajili vile hiyo PMCTC imenisaidia, nimejua status yangu na pia nalinda watoto wangu.
Project Sunshine is based in the Pediatric Comprehensive Care Center, whereby we have kids who are attending for medication of HIV, and we normally do some activities before they are seen by the doctor. Basically, kids, when they are told to come to clinics, they normally think of injections. So when they come to our center, they find something different. Initially, we were 4 volunteers, but we have now grown. We are 16 volunteers.
At BOMO, we always want to improve our quality and yet not raise our prices. And we can only do that if we get support from various agencies, from various individuals.
Our vision is far from over.
PEPFAR is the President's emergency plan for AIDS relief. It's been in existence now for over 5 years to really make a massive effort to eradicate HIV/AIDS through prevention and treatment programs around the world. BOMO Medical Clinic is a perfect example of using aid funding in partnership with a non-governmental entity and achieving results, which we can actually measure. We can actually see the impact that they've had on the community. So it's a huge success story and a very positive. It's really been a showcase for the success of our PEPFAR program and partnerships.